Hello and welcome to the High Maintenance Hippie podcast. This is your host, Ashley from Ashley Taylor Wellness. On this podcast, we talk about all things beauty, health, wellness, and optimization. Being a high maintenance hippie represents not being boxed in, as I strongly believe that one size does not fit all. I'm a nurse turned coach, and I have learned so much about both conventional and alternative options, and I want to help you expand your options. I'm here to inspire you to learn new ways to improve your quality of life and to take your power back. I'm so excited that you're here, so let's get started. Hi, and welcome back to another episode of the High Maintenance Hippie podcast. Today, I have Darrah Kempka with me. She is an RN who does a lot of ozone therapy, and she is the owner of Natural Infusion Partners and also the nurse training event. So thank you so much for being here.
Thank you so much for having me.
Yes. I know that we're both nurses, and I certainly didn't learn about ozone therapy in nursing school. Did you?
No, absolutely not.
So what was your history like as a nurse before getting into the area that you're in now? Tell us a little bit about your background.
Sure. So I graduated from Baylor University, which is a pretty, it's a private school, pretty high, reputation for nursing school, and had a great experience in 2010. And I was in conventional medicine for at least 7 years before I had ever heard of ozone therapy or even functional medicine, or really even understood like what organic foods meant, so there was quite a bit of time spent in the conventional world. But I will say that my work history has been a bit unconventional, and I think I've always kind of been this way at heart. I just didn't really have any awareness to any other way until about 2017, 2018 with my second son. So before that, I did a lot of IV therapy. Pretty much my entire nursing career has been in the IV space. And I worked a lot with IV antibiotics. I would see patients that would have these chronic infections that would be on IV antibiotics at home for sometimes up to like 9 to 12 weeks. I would work with TPN, which is nutrition through the vein. We did some chemo and biologic drugs and IVIG. So a lot of experience in the chronic illness space in that, kind of world. I also worked in neurology kind of closer to the end of that time and dealt with a lot of like MS and chronic neurological conditions. And it really wasn't until I have 2 children. One now is about to be 9 and one is about to be 6. And when my younger son was a tiny baby, like 2 months old, he developed severe eczema, and it kind of propelled me into this world of nutrition and food as medicine and functional medicine. And, someone along the way had told me, have you tried removing dairy from your diet? And it really helped a lot. Not completely. We ended up having to supplement with omegas and, some other things to get it to really go away completely. But it sent me down the rabbit hole of podcasts and research, and I found functional medicine, and then I started like talking about it with my neurological patients. Did you know you can reverse Alzheimer's? And they thought I was crazy. They used to tell me that there's no healing that can happen in the brain once there's been damage. And I think that's, that it's not plastic. And I saw a lot of resistance and not a lot of opportunity to grow and to learn and to kind of think outside of the box. And I had a lot of patients who would want to know, like, what more that can they do? Like, what can they do at home, whether it be moving more or eating right or, vitamins and all these things that we don't learn in nursing school, or at least they don't spend a lot of time educating us on how to talk to our patients about these things. And it was really through my patients being curious that kind of propelled me into asking more questions. And then when my son also experienced that and, conventional medicine didn't have any answers for me, and like literally thought I was crazy for changing his doctor so many times because they didn't have any answers for me, to kind of get me to jump ship. Now I'm about 6 years into it, and it's a whole new world.
Yes. Well, I can relate a lot to that. I finished nursing school in 2013, and I learned about ozone when I got sick in December of 2017. And then in February of 2018, after really suffering, I mean, full body hives, eczema, I had a lot of inflammation, and I remember losing my memory from night shift and other things. And I was just so sick. But unfortunately, the conventional system did not meet my needs. I saw 5 doctors, was on 9 different medications, and my blood work looked fine. So therefore, it was at first all in my head, but then clearly I was covered in hives. So it wasn't in my head. It's just, we don't have the answer for you. And that's how I found Ozone. And my doctor, she was an integrative DO. And at the time we were in California, so she could do it. And it was experimental. But at that point, I felt I had nothing to lose. And in 2 treatments, I felt like I got my brain, my quality of life back. It didn't heal what was actually wrong, but it alleviated the symptoms in a way that wasn't causing more harm. So it's interesting we found out about it at the same time. So for your son, was he doing IV ozone therapy, or were you using it in a different way?
So I actually never used ozone on him at that point. The first time I ever used ozone on my children, which I do now, but like my introduction to ozone was more when I was ready to leave conventional medicine and neurology that I was working in, and I got a job in a functional medicine space. And this doctor is like a world-renowned functional medicine practitioner that kind of specializes in mold toxicity. And so very busy clinic. They had just brought in a doctor from Louisiana who brought an ozone generator with him, and just, it was like perfect timing. He really needed a nurse that could run an infusion room but also learn a new skill, and that was like exactly what I was looking for. Long story short, I got a lot of experience performing IV ozone on really sick clients, and then the pandemic happened, and that's when I first received my first IV treatment, more as a preventative measure than anything. Our doctor kind of just let everybody do it as insurance for us. And I felt amazing. And then I ended up purchasing a home generator, I think the same one that you have back then. And I kind of just used it as a just in case something were to happen or a friend or family needed it. Yeah, and it just kind of grew from there. And now my kids get ear insufflations and sometimes nasal insufflations and sometimes the lung treatment. I've never given them IV or rectal insufflation, but there might be a time when that would be indicated, and we talk about that with pandas and pans, and of course, detoxing situations, and we can kind of get a little bit more into application a little bit later if you want. But for us, it's mostly as needed for illness, and then for me, I do it for wellness maintenance, usually probably about once a month.
Okay. So what types, you mentioned mold, what types of patients did you see who were benefiting from ozone therapy?
Definitely your infectious patients. So anything to do with viruses. So we saw a lot of Lyme disease and Epstein-Barr disease. I even had experience with HPV, and shingles is an indication for UV light therapy with ozone, which we can kind of talk about too. And then cancers, mold, of course, parasitic infections, fungal infections, acute illness, chronic illness. When you kind of start talking about how ozone works with the system, you kind of talked about it a little bit. It's really great at addressing symptoms, right? Acute symptoms, because it works on inflammation and pathogens. But what's really cool, the other piece of how it's so helpful in the body, is it can also address root cause as long as we kind of understand what the root cause is. And a lot of times when we're talking about root cause medicine, it really comes down to like 2 things, right? It's like oxygen utilization and mitochondrial dysfunction. And so luckily ozone does all of those things. So we're talking about inflammation, infections, mitochondrial health, oxygen utilization, and immunomodulation. So that's like everything, right? It's like autoimmune disease, tissue repair. So like in general, rebuilding tissue. Yeah.
So long story short, I've always been told inflammation and infection are the biggest things. So typically we would use steroids, we would use antibiotics, we would use other types of medications that I am not against, and I think there's a time and a place, but sometimes they have side effects and collateral damage. So as the patient myself, I never experienced any negative symptoms from any of my IV treatments. The day of, I actually did it this morning, and I haven't done it in a while, and my blood was a little bit darker than it usually is. And tomorrow I know, and I wear an Oura ring, my scores are going to be phenomenal. I wake up feeling like Superwoman. And so I used it when I was chronically ill, but also when I just want to optimize and feel better. And in the IV room where I used to go, there was this man who was much older, and he was like, it's what makes me feel good. And he had so much life. And just like you said, it can be used for treatment, but also for prevention and just helping give ourselves a boost. So how exactly does that work? What is ozone doing with the blood in the system, if we're speaking about it in an IV sense?
Sure. So I kind of talk about two things when we're talking about really the nitty gritty of how it works. One of the things that we talk about is ozonides. And so this is what is the kind of byproduct of when ozone, which we'll kind of back up a little bit and talk about what is ozone. So ozone is oxygen, but the difference then, like the oxygen that you're, used to thinking of, or that we're really breathing in, is that's O2, and we're talking about O3. So it's a technically a highly reactive form of oxygen because of that third oxygen atom. And if you think back to chemistry days, and you can remember that, atoms want to have a pair. And so because there's an uneven number, that third atom wants to be donated. And that process is called oxidation. So this is an oxidative therapy, which we can talk a little bit about oxidative stress too. But when we're talking about how the ozone reacts in the body, that donation of the oxygen atom happens, especially when we do IV ozone, or when it comes in contact with tissue or with blood. It interacts with lipids and proteins. It really kind of interacts with most things, but when it interacts with those two things, it produces ozonides or peroxides. And so these are the healing mechanisms of the therapy. And so those go out and work on different pathways in the body. And then the other thing I talk about is Hormesis. It's a hormetic therapy. So a lot like, cold plunge or exercise, where it's a stress on the system that produces a healing response. So the stress with ozone is called oxidative stress, and the response is antioxidative.
Yes.
Yeah.
So that's a little confusing for some people, myself included. I struggle to wrap my mind around that.
Yeah.
Because some people think if something's good, then more is better.
Right.
And I actually found that to not be the case. And the way that my doctor the nurses at my doctor's office administered IV ozone therapy was MA, or major auto chemotherapy. And that's something that without ozone, I believe, has been a practice where the blood is taken out and then reinfused. So where I had it today, about 200 cc's of my blood was taken out, mixed with the ozone gas, and my darker blood becomes very, very bright red, and then it's reinfused. I've tried high dose ozone, and that's usually done with a machine, and I didn't feel any better. It cost a lot more, and I actually felt worse. So perhaps, speaking of hormesis and hormetic stressors, do you think that maybe it's because it was too much for my body?
100%. With any hormetic therapy, the healing comes with the adaptation to the stress. So I think there's two things to kind of talk about. Is like, if depends on the system, your system going into the therapy, like how much stress is there already, and how much capacity do you really have to take on more stress, and then really how much rest and flexibility do you have in your system to adapt to the stress. So definitely the dose is the most important piece with ozone. And I am like your practitioner, and my philosophy is low and slow and less is more. Right. And so, and especially for women, we know that because of our like chemical makeup and just life in general for women, we don't need as much stress to have a healing response. And I've seen amazing results with very low doses of ozone. And so I just don't see the necessity of going with those high doses of ozone unless maybe certain situations arise. And if you're going to do that, definitely start with a low dose and work your way up. The other piece of it too is we talk about drainage pathways, right? So especially when we're talking about toxins, when we know that someone has a high toxic load, which it sounds like to me, and I don't know like your entire story of what was at the root, but typically with chronic conditions, there is an infection, and the system, especially when there's stress, doesn't allow for our body to be in flow, right? It's like we talk about the toxic bucket, and when the bucket gets too full and the spigot is clogged, then the toxins begin to overflow, and that's where you have symptoms. Well, with ozone, I don't know if you've ever heard the phrase like kill, bind, sweat. So that's kind of the idea, right? We want to kill the pathogen, and then we need to bind it to get it to be eliminated, and then we have to eliminate it. So ozone does a really good job at killing the pathogen, but then our body and our system has to then get rid of it. So if we have what we call blocked drainage pathways, and then we go in and we kill with ozone, then of course you're going to feel worse before you feel better, because those toxins don't have anywhere to go except to your healthy tissues. So that's a Herxheimer reaction. We call that a Herxheimer reaction. And there's definitely ways to prevent those and to mitigate those. And in my professional opinion, and with the experience that I've had, we don't like to see intense Herxheimer reactions, especially over and over. And when I have seen patients experience that, they're usually getting it elsewhere and then coming to me. They're dealing with mast cell activation, adrenal fatigue, emotionally and mentally worn out from the process. And so it's just something that it's my philosophy is that a Herxheimer reaction is good information, right? It's indicating to us that we're getting to the pathogen, that it's quote unquote working, but it's not necessary to experience a Herxheimer reaction for healing. So that's kind of my 2 cents on that.
Thank you for addressing that. And a Herxheimer reaction, if you're experiencing that and you're killing pathogens, but you're not able to have the effective drainage to eliminate, then I don't know that that's actually helpful and can be damaging to the organs. At least I know that's true for parasite cleansing and heavy metal detoxing. If you are not able to eliminate what you're trying to mobilize, it'll just recirculate in the body and make somebody feel worse sometimes.
Absolutely. Yeah. And so that's what you mentioned. I have the training program. And so that's where I feel like working with an experienced ozone provider who can assist you in getting to a place where it, is quote unquote safer to go into a detox protocol using ozone. That's where you're going to find, healing for sure.
Okay. So when are your favorite times to receive ozone therapy? You mentioned in 2020 that you used it preventatively. I like to do it before going on an airplane. It was the very first thing that I did when I found out that I tested positive from CV, when I was actually not working at bedside, which is so funny. I didn't get sick the whole time. But that was the very first thing I did. And 24 hours later, I felt amazing. I did other things as well. But when do you feel that it benefits you the most?
So personally, same story with CV. Like I was pretty much on the front lines. I was working with people didn't have a lot of places to go when they were sick with this, especially at first. And so we were getting a lot of traffic for that. And so, yeah, so all I'd say, when I did get sick, I was pretty sick. And I did ozone with UV light the day my symptoms started. And one really cool thing about ozone is it will go to, the way I explain it is, if you had a large field of crops, all different crops that all have all different water needs, and you water the field, the water is going to go to the thirstiest plant, right? So it's like ozone works the same way. It's whatever tissue in your body has the greatest affinity or need for ozone or oxygen, then that's where it goes to first. And so with acute illness like that, like something like CV, we don't see a ton of negative detox symptoms because we're working a lot with the immune system and the anti-inflammatory benefits of it. I like to use it a lot, and I'll use regular standard dosing with UV light in that situation. And same was 24 hours later was way better. The other time I use it, I will use it probably monthly for maintenance. Mm-hmm. We call that maintenance, right? Just kind of, that biohack type where we're just trying to optimize our health. But also I'll do rectal insufflation once a month on the full moon to help with parasite protocols. And then I'll do it vaginally every once in a while too. I live on the lake and we have a boat. And so anytime I go out in the lake, I'm always doing vaginal insufflation when I get home. And then, with my children, we're trying to prevent antibiotic use, or we got congestion and their mouth breathing, that kind of thing.
Yeah. So someone that I'm very close to had an infection on the arm, and typically in the conventional world, first thing you take antibiotics. And I'm not against antibiotics, but I said, would you be open? This person was already receiving IV ozone therapy. I said, if you go right away, first sign of symptoms, see if that's helpful. And the next day it was healed up, and it almost looked like it could have turned into a boil of some kind. At that time, ozone bagging, it didn't seem to be as effective as the IV ozone therapy itself. So I haven't had the best experience with limb bagging, which is, let's say that you have, and you can explain this better than I can, but something on your arm or your leg, you could essentially put a plastic bag or something like that and then pump the ozone gas into that. And that works in some cases, but what have you seen as far as success with that compared to receiving it IV?
So I like ozone oil for skin. It's oil is one way you can preserve ozone molecule. Otherwise, you really want to, if you're going to make ozone water, you have to drink it within 30 minutes. If you're going to use the gas, you want to use it really fast because it will switch pretty fast back to O2. But if you bubble it through oil, what happens is actually it binds with the lipid and creates the ozonide, and it will preserve it, and it's amazing for skin stuff. And so I usually will go towards the topical application, or I'll do ozone cupping. Have you seen those? They're like a glass.
No. Well, I've heard of cupping, but not ozone cupping.
Yeah, so they have, if I step out of my window really fast, I can show you what it looks like. But it's really cool.
Okay, let's see. Learning something new every day.
They come in all different sizes. This is one. And so you can it's more like doming than cupping because there's not really a lot of suction that happens.
Okay.
But you can just place that over the skin, and that way it's a little bit more centralized to the area.
Yes.
I've done this on bug bites. I've done this on wounds. I've done this on injection sites. Yeah, it's nice. The other method I would do, of course, IV is great. That's going to address any infection systemically and kind of heal from the inside out. The other way that you might try is injection method. So you can literally inject the gas into the tissue as well.
I've heard of people, even my dentist uses ozone, which is so cool. So we think that it's this woo-woo thing, but my biological dentist, she uses it. And my understanding is that it is not safe to breathe. And so what she will do is put suction in my, in the back of my throat, and then use the ozone here so that way it's not,
that's smart.
I'm not inhaling any of it.
Yeah.
So what would be the risks associated with ozone therapy? What would someone not want to do or be exposed to it if they're receiving it?
Yeah. So talking about the lungs a little bit more in depth, the reason why our lungs don't tolerate oxygen is because they don't have any antioxidant buffering system, which makes sense, right? It's like the role of the lungs is to absorb oxygen. And so it does not handle oxidative stress very well at all. And so if you were to breathe in a large amount, and by a large amount, I mean, I think studies have shown a full entire minute of 20 gamma, which, if you've gotten any ozone inhalation, that's impossible. But if you were to do that, you can cause permanent damage to the lung. Otherwise, it's more of an irritant and it will cause you to cough pretty intensely. And if you have asthma or bronchospasms, this is really important for you to just avoid, because it can cause, bronchospasms and worsening of asthma. So aside from lungs, our body creates ozone naturally. It's the way our body fights off infections. So it's kind of like being allergic to water. There's really not a lot of contraindications to ozone specifically, except for maybe the detox pathway thing, right? It's definitely want to assess that and talk about that and prepare the client for that and tell them kind of what that looks like. Usually when we're talking about contraindications for IV ozone, it's more in relation to the heparin that we use. So you had mentioned before, we take the sample of blood, usually around 200 mLs. And so when blood leaves the body, it will clot. And so we have to use heparin, which is, a blood thinner. And so there are contraindications in relation to heparin, which is why it's really important that you are working with a medical provider to, do the background check and make sure you're not on any other blood thinning medications that could possibly, increase your risk for bleeding. Usually, if someone's had a head injury, we don't want to add heparin. If someone has rectal bleeding, we want to be careful not to make that worse.
Okay. So I want to back up, and just one thing you said was the lungs don't tolerate oxygen. Did you mean to say ozone, or do you mean oxygen?
I meant ozone.
Okay.
Yeah.
That's what I thought, because I'm all right, just double checking. So
yeah,
O2 is fine, but the O3, the ozone itself will cause that coughing. And I was actually around a pool that was ozonated, and someone was sensitive to it and they started to cough. So maybe there was a lot of ozone there. But okay, thanks for clearing that up. And
I will add too, if that happens and you cough from ozone, to take vitamin C orally.
Okay.
And I usually recommend taking about 2,000 milligrams every hour until it resolves. And the reason why is because it's an antioxidant. So we're reversing that oxidative intolerance in the lungs.
Okay. Okay, so you mentioned UV light, and that's actually what my doctor did when I was first sick. One of the things that was overloading my system, filling up my bucket, was this chemical MTBE. And I lived very close to an oil refinery when I was in California as a traveling nurse. It's not something that's naturally occurring. Apparently, they banned this chemical in 2009, but they didn't order a cleanup. I was there in 2016. It was positive in the soil and the groundwater. My doctor even mentioned this legal case. I was so exhausted and sick. I didn't feel like even fighting that. But so my levels were 6,000 times higher than what should be in a body. So I was very sick. It was awful. And one of the things that we did was the IV ozone and the IV tubing ran through a machine on its way back into my body. Ultraviolet blood irradiation, UBI, UVBI. So can you tell us a little bit more about that?
Yeah, absolutely. I was introduced to UVBI probably about 6 to 8 months after I started using IV ozone in our practice. At the time, I was working at another clinic. And so, I had patients that were in the middle of protocols, Lyme protocols, mold, detox, cancers, or whatever. And then I went and received this training, and we purchased the equipment, and we started incorporating this pretty much in the middle of therapy, which was a really cool kind of case study, right? It's once we started adding the UV light, we saw better, faster results and less detox reactions.
Okay.
So that's what I've noticed with it. It's UVA, B, and C. And typically, the equipment that I use, it sounds similar to the one where the tubing has a glass quartz piece.
Yes.
And inside of that piece, there's mechanism where it spins the blood around so that all the cells get exposed to the light. And, C is germicidal, B is more of a balancing light, and they say A has this like immunomodulation benefit to it. So, because of the equipment and because of the tubing that is disposable, like it's more expensive. So if I could recommend to add UVBI to ozone every time, I would. But because it is so expensive, I typically will talk about it more when I have a viral patient, whether that's acute or chronic, an autoimmune patient, or a cancer patient. And so those are kind of where I've noticed the most benefit. And then also like your client who just wants to get a little bit more out of the treatment. What they say with the therapies is, UVBI is its own treatment and ozone is its own, but when you put them together, they have an amazing synergy, which makes sense to me because this is how like ozone is created naturally in our atmosphere, right? It's like the rays from the sun create our ozone layer around our Earth through this kind of same mechanism. So it's a really amazing add-on therapy.
What would you say to somebody, and I honestly don't know the answer to this, we have seen weather warnings, high ozone, it's not safe to go outside. So
yeah,
that makes a lot of people think that ozone is dangerous. Now, is that because we would be breathing it in, or what would you say about that?
So there's a couple of things I would like to say. Well, first of all, just because ozone isn't safe to breathe in doesn't mean it's not safe, right? It's like water, like it's not safe to breathe in water, but obviously water is helpful for us. So
okay,
that's one thing. But the other thing with the warning lights is it's actually not the level of ozone in the atmosphere that they're warning us against. It's the smog. And the way that we can, which, smog is when we have the chemicals and the nastiness that comes out of like factories and cars and stuff, and it mixes with, and it gets into our lungs, right? So that's smog. But the way we can tell that smog is rising is that naturally in our atmosphere, ozone rises. So they use this as a measuring technique on how we know that the smog is worse for us. So it's not necessarily like, yes, it's dangerous to breathe in high amounts of ozone, but remember, you have to get in like a whole minute of 20 gamma, which that's not happening in our atmosphere. And if that was, anyways, that just wouldn't happen. So yeah, it's a very big misconception for sure.
Okay, that's my first time hearing about that. Do you know when ozone was first discovered?
I do remember that they were using it in World War II for wounds, like injured soldiers, and that it was being used in the medical community right before penicillin was discovered. It was actually in a Time magazine the year before penicillin was discovered, for being like the next best, medical invention. And there was an article written on two patients. One was a septic mother who was saved using ozone, and another was a child who was bit with a dog that had rabies, who was saved using ozone. And so that Time magazine was, look up when penicillin was invented, and it was the year before that. So it's been used for a really long time. I know locally in the United States, Dr. Frank Schallenberger has been using it in practice for over 30 years.
Okay.
Yeah.
So it's been around, and it's not something that insurance covers, as far as my understanding. Is that correct?
That's right. It's because it's not an FDA approved therapy. And, I don't know if that will change one day. Not sure if that would be the best thing, but it's not a drug, and it's not super profitable. So it's oxygen. So the only way that they would be able to do that is by the machine itself. And so I think there are some companies out there that are looking to get FDA approved. I don't know if that's ever going to happen, but yeah, currently it's not covered by insurance.
Well, I found that through my own healing journey that unfortunately the things that helped me the most were not covered by insurance. And that's a rabbit hole that we don't even have to go into. But it is interesting that the things that helped me the most, I had to pay out of pocket for. So it's really challenging to be a nurse in the hospital, especially in 2020 and 2021, and to tell people, we're doing everything that we can for you. Yet if I got sick with that, which I did after leaving, the things that I chose were considered, pseudoscience, not effective. And within 24 hours, I was feeling amazing. So that really breaks my heart. And I don't want to be too controversial, but, we have to ask why. And why are some things, more available? And I haven't experienced or seen collateral damage with ozone therapy as far as, other than a Herxheimer reaction, which if your dose is too high, of course, but with antibiotics, time and a place.
Right.
Wouldn't be my first choice, but there's a time and a place. I had surgery, so I took them. But we know that can negatively affect the gut, which can make us susceptible to other things. And I gave antibiotics so many times when we didn't even know if the person had a bacterial infection. So with ozone therapy, we don't see that collateral damage. So why isn't it something, I think we know the answer, but the question to think about at home is, why wouldn't that be something that we explore more to help people without all of these side effects and without all of these potential risks that would make us more prone to illness in other ways?
Well, I think conversations are so important. There's definitely not enough conversation about ozone. A lot of people just don't know it exists, right? And so, yeah. Especially me, I worked in the IV space for 8 years, and I love to research and learn about new things, and I had never heard of this. And so that's why, and I think you share this passion of mine is that's why I talk about it so much on this platform. And, I love doing podcasts and things like that where we can really spread the word. I would love for every, primary care doctor or pediatrician to have just at least an insufflation station at their office. Anyone can purchase this equipment. You don't even have to be a doctor to do it, but for sure, if you're a doctor, you can absolutely have that in your practice. And it's more just about getting practitioners comfortable with this therapy and getting them confident in their ability to talk about it and their ability to use it and to try it, especially with kids. We know, a lot of times with kids and with pregnancy and these touchier things, doctors just want more confidence in its ability to do that. So I think, what you're doing is so important, and also getting out there and, like you said, investing in your health, but also investing in your own education.
And just observing. I've been a nurse for 10 years. It's 2023. So in 2013, that's when I became a nurse. I've worked on and off since 2018. And I really didn't feel that I was seeing people thriving. I felt like we got them from survival to stable. Great. But I wanted to see people thrive. And so I've spent a lot of time in the alternative medicine space, functional medicine space, and just seeing the differences in how people eat, how people live, the different treatments, and there does seem to be a difference. So I know evidence-based practice is something that is really, really hammered home in school, but I have gone on PubMed, and there's so much research on UVBI. If you have to look for it. I would imagine ozone therapy as well. I did post a lot of those things on Instagram. I would get flagged, so I took it down, and it's just, if you're interested, you can find this information from reputable sources as well.
Absolutely, especially after this pandemic, there's been a lot more research on ozones and its effect on viral illness. They're using it a lot in other countries. And so you'll see that. I think you and I talked briefly once about this process that happens, especially with nurses or medical professions, where it's almost a grieving process that we go through once you become aware of these tools that are so helpful. And, you think about what goes on in the system and, how much money, and it's just crazy, what is actually going on. And when you first become aware of it, it's hard. It's I remember being angry and sad, and then there's the bargaining that happens. Maybe if I show them all this research that this is an amazing, effective, safe therapy, then they would understand, and that's just not the case even. So it is really frustrating, but I think, again, just the more that we talk about it and the more that we are open-minded, then, we're getting there for sure.
And for anybody watching or listening, just sit back and observe and ask people about their experiences who have received ozone therapy, especially if there's someone who has really struggled to have their needs met in the conventional system. And it's so interesting that I saw a commercial on TV yesterday. I forget what it's for. I think it's Walden University. Don't quote me on that, but it's this nurse and she's looking at herself in the mirror and she's so sad. And she's like, remember why you became a nurse? You wanted to help people. And then she's sitting down at a desk and she's like, I just have to go back to school and then I can change it. And it's like, it's so commonly accepted that our healthcare system is just not meeting the needs of our patients that you see that on a commercial for a nursing school. Oh, just go back to school and learn more. And hospitals, great for surgery, emergency, trauma. But I think we have more options, and a lot of people live in poverty. And this is something, once again, not covered by insurance. So I'm not going to suggest that if it's not something that is feasible, but I wish that it were. I think Dave Asprey talks a lot about biohacking and the things that cost a lot of money. He's like, cell phones used to be crazy expensive, and over time, the more it was normalized, it became more accessible. So I hope as the word gets out, and once again, you don't even have to try it. Just watch people's stories and see what is happening for people. And I am absolutely living proof that it was a life changer. I mean, within 2 treatments, I was so miserable. And it is the one thing that would make me really want to stay in nursing is to do ozone therapy. I'm really loving coaching, but there are a lot of nurses who want to be in that nursing role and they just don't know how. So what might that look like? I know that you teach nurses, but if someone's not ready to have their own business, could they maybe work for a functional medicine doctor to learn more? Or what would you suggest for someone who wants to work for a doctor who is a nurse today?
I mean, obviously the more knowledge that you have and the more like skill set that you have, the more hireable you'll be. The thing about working within the functional medicine space, like if you were to go like join a practice, is that any private practice, maybe the pay isn't going to be quite there. And I can fully like understand that I did that. I took a pay cut to kind of get into this space because I thought it was more of an investment of learning something new. Never in my wildest dreams did I think I would be owning a business that's like not really my specialty. Like I'm a practitioner, and so I don't think that you have to own your own business, but I do think that understanding how to use ozone, even in an insufflation method, of course, IV is great. There's probably more benefit there for finances if you can do an IV ozone, but I think that every office is going to have an ozone generator soon. Like it's definitely growing. The demand for ozone is a lot higher than it was even 5-6 years ago when I first started. A lot more people know about it. I tell my patients and my friends and my nurses that buy an ozone generator, I'm like, you're about to become the neighborhood ozone lady. Like people will start, your friend will be like, oh man, I'm so miserable. I have so many allergies and congestion. And you're like, come on over and I'll just easily, pretty fast put some ozone in your nose and your ears. And I mean, there's so many ways that you can incorporate this therapy. It's such a great gateway into natural healing, and it's an amazing skill that you can have, and it doesn't cost a lot. The initial investment I would say is around maybe $2,000 for the equipment and the oxygen tank, and sometimes it can be a little difficult getting oxygen, but it's possible. It's not impossible. And once you have your setup, then it's very inexpensive after that. So, and there's not a lot of training, especially 6 years ago when I first started, there was little to none clinical training. I'm a nurse. I want to understand how to manage my patient from a nurse perspective. Of course, there's the science piece of it, what is it doing, and then there's a step-by-step, but there's a little bit more when you're a nurse to kind of understand how to really support your patients. There was none of that, and so that's why I created a program, and I do this as a side passion project. And it really started through Instagram. Like probably half of my following is nurses or practitioners that want to learn this therapy. And so it was like people just were reaching out like, can I come and shadow you? Or how did you learn what you're doing? And so really out of necessity, I built this program. And so that's definitely an option. There's other training programs. A lot of the training programs that are available are by the equipment companies that are out there. Yeah, not a ton of options, but there is some.
So IV is more expensive. I do find it to be very, very effective, but other ways to use ozone therapy. So if you were to invest the $2,000 in the ozone generator, we both have one from Simply O3. I believe that's the one that you use, correct?
Yes.
So I was told that 5 rectal insufflations would equal 1 IV ozone therapy. And today I paid $250 for an ozone session. So let's multiply that by 5. I mean, that's $1,250. Very quickly, an ozone generator would pay for itself. So we have rectal insufflation, vaginal insufflation, what would you call it? Ear insufflation?
Ear, nasal, and then there is a way that you can do it into the lungs. You kind of what we talked about earlier is you bubble it through oil, and that will break it down into its ozonide form, and then you can inhale those. And that treatment, we call it BOO, or breathing in ozonated oil, olive oil. And then there's injection method, so where we inject the gas into either the joint space or into tissue directly. There's topical application. You can make ozonated water, and you can then apply that water topically, or you can drink it, or you can put it in an enema or in a nasal lavage. Plants love to drink ozonated water. You can disinfect surfaces with it. I mean, there's limb bagging and cupping, which is more like kind of in the topical application. And then with IV, there's also a couple of different options. You can do what's called major autohemotherapy. There's also minor autohemotherapy, and that's where we take a small amount of blood, so usually around like 10 cc's or less, and then we mix it with the ozone and then either re-inject it IV or into the muscle. And so that's one method. You can, and then you can do ozonated saline IVs. This is not my favorite way to do IV ozone because saline or any fluid that has electrolytes or like a charge to it, so ionized or electrolyte water, it's not going to absorb ozone as well. You really want to use like a distilled or filtered at least water to get the best absorption for water, but for ozone. But for when you're doing an IV, obviously you need to use saline. And so if you're going to get an ozonated saline infusion, make sure that they're using the right equipment where the saline is being ozonated as it's being infused. So if they just have a bag of saline and then they inject a couple syringes into the saline and give it to you, it's probably not going to be very effective. But that is one method. And then there's, you'll hear all these different terms. You'll hear single pass or 10 pass, or even sometimes like a double pass or triple pass. And what that's referring to is, so the process for major autohemotherapy or IV ozone is we start the IV, and then we attach the tubing in the bag, and then we take the blood sample, whether we use gravity to do that, where the blood just lets into the bag, or some nurses will take it out with a syringe and then inject it into the bag. It doesn't really matter. I prefer the gravity method just because you have less issues with sticking yourself, and also hemolyzing the blood cells can cause a little stress on the cells when you use a syringe. So I just prefer the gravity method. So anyways, you let the blood and then you give it back, and that's a single pass where the blood comes out and then it comes back in. So a double pass would be if you did that twice in a sitting, and then a 10 pass would be if you did that 10 times in a sitting, and that is considered high dose ozone. We also have EBOO, which I don't even think I can tell you what the acronyms. It's like extra blah blah blah. It's a big word.
Yes.
Yeah, and so EBOO, and so that's where you have an IV in both arms, and they're taking blood out one side, and they're not taking all of your blood. They're taking about, I think, 1 liter of blood, if I'm correct. Actually, I haven't been trained technically on EBU, but I think that's what it is. And then it gets diffused using a filter. And this provides for greater surface area absorption of ozone. And then it comes in back to you through the other arm. And this is, again, very high dose ozone and can be very expensive. 10 pass is using a lot of heparin. It's a lot of ozone. So again, I'm very all about low and slow and less is more. If I was going to use EBU or recommend EBU, I would say, people that are having really high levels of oxidative stress, like cancer, or maybe I know it's really helpful with long COVID. And so I would say if you had addressed it in every single way and you didn't have any other tools, maybe consider EBU. But again, I haven't been trained in it. I don't have any experience. So I can't say from professional or personal experience, but to me, it seems unnecessary. Why fix what's not broken? If MAH is working for you, then I feel like there's not really a need for that.
That's definitely my preferred method. And actually, you were the first person that I saw to do it in the gravity method, where, the needle is in or the catheter is in, and then the blood will just go down. But that actually does make sense because of the suction from the syringe hemolyzing any of the red blood cells. So very good point there.
I think we had a hard time draining your blood, which,
if I'm cold, it's not happening.
We were in a conference room, there was just a lot going on. It was the end of my day. So, there are some troubleshooting things that can occur to help with that. But
it's very interesting. If my mental state makes a big difference on how cooperative my veins are going to be.
Totally.
If I'm cold, if I'm stressed, if I haven't had enough water, then my veins are just not going to cooperate. And I've done probably close to 200 IV ozone sessions over the years.
Wow.
A lot. And it really, really, really helped me. I mean, I feel like my skin's brighter, I have more energy, all of that. But even today, I find if I keep my feet up, I'll use a heating pad before, even if I don't need it. But if I'm cold, it's just not happening. And maybe that's because I believe that it's not happening. But I do tell myself I'm safe. My veins are cooperating today. But some people are just hard sticks. I happen to be one of them. But if I'm more in a warm setting, then it tends to be more accessible for any type of IV treatment. But it's different because a regular IV, you just are infusing, and this you actually have to pull or take something out first. So you have to be hydrated and, in my case, warm.
Yeah.
So yeah. Okay, a couple questions from people. Is it safe while pregnant?
I get this question a lot. Yeah. And I think most people would say probably not a great idea.
Okay.
And I think that comes from a space of we just don't know, right? It's and the liability issues with that. And in general, you don't want to detox while you're pregnant. Definitely if you have Lyme or mold toxicity, being pregnant or breastfeeding is not the time to do detox with ozone. However, to me, it's kind of you're looking at risk benefit. Obviously, dose matters. If a patient is going to need to be on, a pregnant woman is ill or gets an infection and they're trying to avoid using antibiotics and want to get one treatment of a low dose ozone to avoid that, the contraindication is really more around the detox. And remember, we talked about an acute illness. A lot of times, most of the time, we don't see detox symptoms really occur unless you're doing it. A detox protocol using IV ozone for us looks like once a week for 3 to 10 infusions. And so usually around, with the dosing that I do, around infusion 4 and 5, that's where we see the detox starting to happen. And so getting one infusion of ozone to prevent the use of antibiotics, you just kind of have to use your intuition. And I will mention here too that there's a doctor, his name is Dr. Baker. I think it's Thomas Baker, and he's in Iowa, I think. I have a recorded talk that he did at a conference an online conference that I attended as an ozone practitioner, and he infused IV ozone on pregnant women up until the end of their second trimester for the indication of reoccurring miscarriages. So this is what his talk was on. And of course, it always depends on root cause, right? It's like what is causing, you know, the miscarriages or the infertility. Super interesting talk, but it was really cool and really an amazing moment in like ozone, world, to see a doctor not only have the guts to like infuse a pregnant woman that often up until second trimester, but then to share about it and to have these women give their stories. And I mean, they felt great. So not a hard no. Definitely want to get your medical provider to give you guidance on that. It's kind of risk benefit. So that's really what I talk about.
I'm much more on the conservative side as far as we don't know. So get as healthy as you can before becoming pregnant. But once again, sometimes the pros outweigh the cons. And that's why this is not, we're just having a conversation. It's not medical advice or this is what you need to do. But these are things to look into and explore and to just see how it might help you.
Yeah.
So how often can people get ozone therapy? I mean, I did it twice a week, every week for about 6 weeks when I was acutely ill. But I mean, could I have done it every day, or what have you seen as far as people receiving it a lot? And these were low doses, though. It was single pass. I wasn't doing high dose every day.
Yeah. Or
2 days a week.
So it depends on the dose, and it depends on the application, and it depends on the goal. So again, like for a detoxing client, someone who we've addressed drainage pathways, they're on good binders, they're ready to detox, then I will look at 1 to 2 times a week, again for 3 to 10 infusions. I like to take a break after 10 and just kind of reassess, like if we're not seeing improvements, maybe why not? And then, maybe do another round. But the weekly is kind of where I really like to see it. And that's because the ozonides last in our system about 72 hours. So to me, 72 hours on, 72 hours off, and you're about once a week. And so that really allows for that adaptation process, that hormetic rest, to allow the healing to happen. I do see it ordered a lot twice a week, and I've done that with people who I know tolerate it well in an acute or severe situation for a short amount of time, and then I space it out after that. With like ear insufflation and nasal insufflation, yeah, I mean, you could do that daily as long as you're using pretty conservative dosing. And also, it always depends on how you tolerated your last treatment. So if your last treatment you got a headache and had to sleep for, in the middle of the day when you don't normally do that, I would not probably do it the next day. I would definitely take some time off to rest.
That totally makes sense. And, everyone's going to respond differently. One size doesn't fit all. In my case, I felt better every time that I did it. And I didn't seem to have any negative reactions. And I'm just so grateful for all that it did. So maybe one day I will come to one of your trainings and I would really learn to love myself. I mean, I feel like I've seen it done enough times, but to have that formal training would be great and learn more about the science behind it. So can you tell us a little bit about how people can work with you and about your events and the trainings that you offer?
Yeah, thank you for allowing me to talk about that. I just had a nurse training event that you did help me promote, so thank you so much. And we had a really great turnout. It was about 20 nurses. We did offer the virtual option as well, so we had some people there. And it's just, it's a big project for me, and I also run my clinic. So I'm only plan on doing those once a year. I am looking at expanding the virtual option and making courses, more online, and then doing the in-person once a year. And so that's what's to come for the nurse training event, probably in next year. But I do offer consulting services as well. So if you already own a business or you're wanting to start a business, and you just need to get trained, I do one-on-one consulting as well. And so you can reach out.
Okay, great.
That way, yeah.
So how can people find you on Instagram? Your Instagram name is?
It's Darrah, so Darrah, Kempka, Kempka, _RN. And that's my page that I focus more like on nursing and educating on ozone therapy. And then my business page is Natural Infusion Partners.
All one, no underscores, no
There's
periods or
dots
anything?
in between. So natural.infusion.partners.
Okay, great.
So if you're local to Dallas or you want to book, I think both of my bios has a link to book with me.
Okay, great. Put them in the show notes too for anyone who's interested. And I just ask that you all keep an open mind and remember everyone responds differently, but it is an option that has truly changed my life. It sounds like you've seen so many people benefit as well. And let's just keep seeing what happens for the future of ozone. But I would love to live in a world where this was implemented on a more mainstream basis, especially in hospitals. I think it could help so many people, but we're not there yet. But I have a feeling that just as time goes on, more and more people will see anecdotal evidence and even hard data and research. So go on PubMed, go look and see what you can find. And it's been incredible. So thank you so much for being here and sharing all of your knowledge and your time. I really, really appreciate you.
Absolutely. Thank you.
Thank you for listening to the High Maintenance Hippie podcast. If you enjoyed this episode, please subscribe to the podcast, rate it, and leave a review, ideally a 5-star review if you loved it. All of this is free of charge and really helps me to be able to run the podcast. If you take a screenshot and tag me, I'll repost you and shout you out on Instagram. So tag Ashley Taylor Wellness and High Maintenance Hippie Podcast. If you have any feedback or guests that you'd like to have, I would love to hear from you so that I'm not just talking at you. I really want to deliver things that are valuable. So send me an email with any feedback, suggestions, or ideas for guests at ashley@ashleytaylorwellness.com. And I will leave you with a disclaimer. Please know that this is not medical advice or replacement for seeking medical care. Everything discussed on this podcast is for educational and informational purposes only. Always consult with your medical provider before making any changes. Thanks for tuning in, and I'll see you next time.